and then it's recording, so cool. Alright, well, thanks to you both for coming along today. My name's Sheree and I'm the dietitian that services this hospital, but most of the time I'm based in community health. But I also go to aged care facilities as well, so a bit of everything. So today I wanted to talk about malnutrition in hospitals. So malnutrition affects between a third and a half of all patients in hospital, so that's quite a lot. And it increases healthcare costs due to increased risk of complications. But in your role here in the acute ward, have you had much experience with patients that are malnourished?
Yeah, this one
One
but
of
20, yeah.
Yep.
There's only 45.
Yeah, I think I'll be seeing him after this actually.
Yeah.
Mr. Kirby.
Yeah. So today won't be going for any longer than 45 minutes. So I'll be going through my presentation, but a lot of it's going to be discussion based, and we'll be doing some practical stuff as well. So hopefully it'll be a bit more interesting. So our outcome today is, I think we've got someone.
Yeah, come. This is student name.
Hello, welcome. We've just started, so take a seat.
Yes.
Maybe sit over there so you don't get it
Yeah, you can see.
shining on you.
Just have a seat here.
Yeah.
Otherwise you won't be able to see that.
Oh, okay.
Yeah.
Thanks.
Just with me.
So hopefully by the end of this session you'll be able to have some knowledge of malnutrition in hospital, the key aspects of nutrition care in hospital, and also just your role and responsibility of nutrition care in hospital. And I'll be mentioning this nutrition care policy, which I guess is the is directing a lot of the information that I've provided today. Which the policy was released in 2011, but it's taken until now for the implementation. Really, that's how long things take, I guess. If you need to run out to the bathroom, they're just down near the lifts, I think is the closest ones. And if we need to evacuate for an emergency, the nearest exits are down the hallway, downstairs. Yeah. So we have this flowchart which shows you the patient's nutrition care journey. So starting with admission and risk screening on the admission form for malnutrition. And then maybe if they were identified at risk of malnutrition, they would get referred to the dietitian. So that's the part that I'll be focusing on today. And a separate presentation would look at things like diets, different diets provided in hospital, different ways of selecting on the menu, delivering meals, helping patients with meals, that type of thing. So a definition of malnutrition, it's a typical definition, a bit wordy, but this is what is on the nutrition care policy documentation. So malnutrition is the state where there's a deficiency or even an excess or just an imbalance of energy, protein and other nutrients, which causes a measurable adverse effect on their tissues, body form, their shape, size and composition, function or clinical outcome. And I guess most of the time we hear about malnutrition as being like a third world problem, but really it's happening in hospitals every day. Yeah. So some statistics, a study came out for
Oh, I'm sorry.
That's alright, we'll leave that. I like it. A blue table. That'll be right, thank you, yeah. So the study was done on Nutrition Day, which is the day where we do a lot of malnutrition screening in hospitals, and they found that up to 50% of patients in hospital were malnourished. So yeah, it's definitely a big statistic. So many patients Many patients might be malnourished on admission, like they're already malnourished before they come into hospital. But maybe as patients spend more time in hospital, they're more likely to become malnourished the longer they spend in hospital for all sorts of different reasons. But can you think of some reasons why they might become more at risk as they stay in hospital for longer?
I think if they need help, I think when you're on a busy ward, sometimes you don't get to all the patients. It's hard.
Definitely, yeah. Definitely. I guess spending a lot of time in hospital as well, you might get sick of having the same food every day and just get sort of fed up with that, wanting to go home. Just becoming more unwell, I suppose, over time as well.
And when they're in the hospital, usually they'll be on antibiotics, which
Yes.
upset their stomachs then.
Yep. Definitely. So many drugs will affect your appetite. Yep. That's a good point. So some side effects if malnutrition is not treated for the individual person, that they will have delayed wound healing, which, I guess with wound healing, nutrition is a big part in that, whether they're eating enough protein or even just eating enough energy altogether, but there are some particular nutrients that are involved in wound healing as well. They'll have increased risk of pressure areas, muscle wasting and weakness, infection, so higher risk of infection, dehydration, impaired mobility, diarrhea and constipation, or one or the other, and apathy and depression. I guess this sort of looks like a vicious cycle as well, so maybe they get malnourished and then they get a pressure area and then they get infection and then it's sort of, they might not be able to eat enough and it's just round and round and round. But then if malnutrition isn't treated, there's some cost to the health system as well, being increased length of stay, increased costs just in general, like maybe they've developed a pressure area, so there's expensive wound healing equipment required. Increased rates of admission, or I guess that should really say readmission. Once they go home, maybe they just haven't recovered with their nutrition status. Greater use of antibiotics, more costs, increased complications, increased clinical intervention, and just increased staff time per patient, requiring more assistance at meal times. But why patients become malnourished? They might be eating as much as they normally do for so many different reasons, just not feeling like it really because they're feeling so sick. Loss of taste and smell, which often is due to having a dry mouth, which is a side effect of a lot of different medications. But if you've got no taste, then no desire to eat. And smell is such a big component of taste as well. Needing assistance with meals and not being able to have access to that assistance, so then not eating as much. I guess lack of access to food, maybe they're stuck in bed and the meal's plunked on the table beside them and they can't reach it and may not be able to eat, then the meal gets taken away before they get a chance to eat. Dysphagia or difficulty swallowing, maybe they needed to have texture modified foods like puree or something, but no one ever really provided that to them and they didn't eat because they were scared of eating. Maybe they didn't verbalise they had a problem with swallowing at all. Alcohol dependence, depression, delirium and dementia, maybe even forgetting how to eat in the first place, and long hospital admission. So really so many different reasons. Even more like maybe they're malnourished, they're eating regularly but the amount of food that we provide isn't meeting their requirements. Maybe they needed something extra. Post-surgery, wound healing, pressure injury, cancer, very much increased requirements if they've got cancer or undergoing treatment. Trauma, and also malabsorption, maybe they're eating but they're not absorbing all the nutrients from their food. Whether they've got gastrointestinal diseases, bowel resection, wounds or drains. So some of the common signs and symptoms of malnutrition, I guess loss of appetite is the first one, which might happen before they start to lose weight, but of course we can recognise that they've lost weight over time and not eating all of the food that's given to them. But malnutrition can occur in overweight people, not just people that are obviously wasted. I suppose we're more likely to pick it up in people that are obviously gaunt and wasted, but people that are overweight might have lost 10, 20 kilos and still